Today, I want to show you 3 easy self-assessments that you can do to identify if what you're feeling in your hip is truly impingement. Now, there are 2 different types of impingement. There is a structural impingement and a functional impingement. So these self-assessments are not only going to tell you if what you're experiencing is impingement, it's also going to help identify is it structural or is it functional. Now, this can be really helpful in determining what the best next step for you is going to be, because if something is functional, it essentially means that it's more of the way that you're moving and more of a muscle problem, versus if it is structural, that's going to be something that is maybe a little bit harder to change, and you may want to go the route of getting imaging done or consulting with a doctor. So either way, these tests can be really helpful in determining if you have impingement and sort of what that next step for yourself should be. Now, these are actually 3 tests that I use in the clinic with my dancers that come in complaining of hip impingement, and this is just an easy way for you to be able to reproduce these at home. So the first test is going to be a standing march test. So to perform this test, what you're going to do is you're going to take one knee, you're going to pull it up towards your chest as far as you can, and then you are going to try to let go without letting the leg drop down. So we are looking for 2 things here. Number 1, am I getting pain or pinching or any of my symptoms at the top range of that motion when I'm actually holding onto my leg? And then I'm also looking what happens when I let go. So a positive sign would be, of course, the pain or the pinching or whatever symptoms you might be experiencing, as well as if when I let go my leg drops. That would also be considered a positive sign. Now, again, if we are getting pain that occurs no matter what, whether I'm holding my leg or letting go of my leg, that generally is going to indicate that there might be more of a structural block there, versus if I don't have any pain here, but the pain increases when I let go. That might indicate more of a functional issue. None of these tests are absolute, keep that in mind. So just because you got pain with both of these, keep going, because again, there's a lot of things we have to look at, not just one test. So for the second test, what we're gonna do is a squat test. So all you're gonna do here is you're just gonna go into a squat. You're gonna stand in a comfortable position where you would naturally do your squat. You're gonna go through the range of motion. And again, we're looking to see, do you get any pinching, pain, hip symptoms of any sort? We're also looking to see how far in the range of motion you can get. Ideally, for you, what you're trying to get to is parallel or below. Parallel meaning thighs, parallel to the floor. So you either want to get parallel or just underneath it without feeling symptoms. So a positive sign for hip impingement would be that you get that pinching or pain, or you just can't get down low enough. It kind of stops you. This is going to be a 2-part test. So the next piece to this, if you had pain here, the next piece to this that you're going to do, you're going to kind of find a lower step. This is about 12 inches. If you don't have something that low, you can do it to a chair, but a lower step is going to be a bit more effective here. And all you're going to do is you're going to sit down and stand up. And you can do that a couple times. And what we're looking for here is, does my pain go away? Can I get, essentially, my full depth? This is a squat, right? Can I get my full range of motion when I'm just sitting down and standing up, versus when I'm trying to do a free-standing squat where maybe I can't get as low or I get pain? If your symptoms go away when you move from the squat to the sit to stand, that's a really, really good sign, and again, would indicate that you have the range of motion in the joint. So very likely not a structural problem, but more of a functional issue that you just need some training on how to be able to move and get into that range of motion without feeling your symptoms. And the third test is going to be a hands and knees or a quadruped rock back. So for this test, what you're gonna do, you're gonna come down onto your hands and knees. You're gonna have your knees at least shoulder width apart, but you can alter that a little bit based on how you feel. And then I'm gonna try to maintain a neutral spine, meaning I'm not tucked under, but I'm also not super arched. I'm just trying to stay right in the center. And while maintaining that spinal position, I'm gonna rock my butt towards my heels. And again, just looking for how far in the range of motion can I get, and do I get a pinching, popping, pain, any reproduction of symptoms, and maybe sort of where do they occur in that range of motion. Now again, when I come here, if I can all of a sudden get my full range of motion and the pinch goes away, that's a good sign, again, that's indicating your impingement may be a little bit more of a functional issue. It's the way that you coordinate the muscles to get the hip to flex. So when you're freely standing or doing your march test or your squat test, if you're like, ooh, I can't get down, I get a lot of pinching, I get a lot of pain, but then it immediately goes away here and I get full range of motion, all that tells me is that your muscles just aren't coordinating effectively in those standing positions. We don't have a structural block, and we just need to teach you how do you move your hip joint. If I still get pain in this position, then again, and limited range of motion, then that might indicate there might be more of a structural issue going on, potentially with the shape of the bone, or possibly even something like a labral tear. So all three of these tests, very easy things that you can replicate at home and figure out, do I have impingement, and is it maybe more of a structural or a functional problem? Now, what do I do next with all of this information? It's awesome to know, okay, yes, I have hip impingement, but now what, Jenna? So what I would tell you is this, if most of your tests appeared to be sort of a functional issue, and you were able to get full range, and some things had pinching and some things didn't, then you are somebody that just needs to learn, how do I move my hip effectively so that I'm not creating the impingement, which down the line can lead to so many bigger problems like tendonitis or a labral tear or just chronic pain. And that is not the way that you want to live as a dancer. So my response to you would be, join us. I have a 4-week online hip impingement coaching group made for dancers specifically with this hip issue. And the idea is that I'm going to walk you through the steps to correct the movements that we see here, all the way up to the dance specific movements. So if you're a dancer that's feeling it with développé, passe, whatever it is, we're going to start with the foundations, learning how do I move in these kind of just base functional movements, all the way up through how do I apply that into my dancing. And I guarantee you guys, at the end of 4 weeks, you will feel like a completely new person, a completely new dancer with a hip that doesn't hurt anymore. And more so, you will understand how to move your hip so that you're very empowered that if that pinching or that pain comes back, you know exactly what you need to do to remedy it. So if you guys are interested in joining this coaching program, I'm going to put all the information attached to this video. You can reach out to me. I'm only running 1 coaching group per month, and there is a limit of 10 dancers per group so that I can give you some personalized support. So all the details will be listed here. You can feel free to contact me if you have any questions, and I hope to see you on the inside.